Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live from the Dolph Simons Family Studio. On my right, of course, is Hawkeye. We welcome him back on the program right there. And on the left is a guest I'm not sure we've had here in the studio before, although she's been with us frequently online, and you'll see her. She does a great job. Erin Corvo. Erin is the Deputy Health Officer for Wyandotte County. And joining us from Studio B is the Health Officer for Wyandotte County, Dr. Alan Greiner. These two folks have been a dynamic duo helping Wyandotte County navigate their way through this health crisis and through the pandemic. Just a hats off to our family medicine department, who continues to do great work across the state. So many of their faculty are involved as health officers in different counties. Joseph Lemaster is in Johnson County. He's been on our program before as well. And there are multiple places throughout the county as well as with KDHE. So we really appreciate the strong work of our family medicine department. And today we're especially hats off to Dr. Corvo and to Dr. Greiner for the great work they do as that dynamic duo here in Wyandotte County. So we're going to turn to them in just a moment about what's going on there, and I'm sure we're going to probably hear a few questions about schools and reopening, and the county and the reopening, and what we're going to do. But Dr. Hawkeye,
hi.
How are we doing today?
We're okay. We're better than we were. So we had kind of recently, in the past week, peaked at like 36. Today we have 33 in the hospital.
Yay!
So that is good. Still 6 on the ventilator. We understand that once you go on a ventilator, if you have COVID-19, you're probably going to be on there for the most part for a while. So
up to 2 weeks. Huh?
We went from 2 to 6 patients on the ventilator. We've been at 6 patients on the ventilator for a while. When we were talking about earlier, we do have 17 of the 33 patients in the ICU.
But it's funny because, as we were also saying, our ICU, we took one of our ICU units, and there's got both floor patients and ICU patients in it. So some of those COVID patients are actually floor status, but they're sitting in an ICU bed. So it gets confusing, and it has to do with how we try to make sure we have enough beds in the hospital. But I think it's 17, but it's not necessarily 70 people who are required to be in an ICU. It's just they're still in the ICU unit because we haven't transferred them to the floor.
And it should be important to note, too, I am seeing a patient right now in the hospital who came from another facility. I think we need to continue to stress that the virus is out there. It is still spreading. Had no symptoms whatsoever. Again, could be early in the infection. We are continuing to monitor and always ask if you have new symptoms, let us know. So there is that going on as well. Hopefully they will be well, but that happened because we are testing everybody who comes into the hospital. And so we find these infections and then are able to really set them up for treatment moving forward and be proactive in that.
Yeah, and I think that is key. And again, as we always try to reinforce to everybody, the rules of infection control follow you everywhere you go. And it doesn't matter if you are in a bar or a restaurant, a school, a hospital, or anything else. If you follow the rules of infection control, you can stay safe. And we've kept our staff safe by using gowns and, well, really masks and goggles up on the floor on COVID units. How many staff have gotten COVID from working on our floors?
We're going to say 0.
And we are saying 0 because we believe that's the number. And it's just a testament to the simple rules of infection control. And remember, it's not a forever thing. It is a thing we should do right now. So, Erin, talk to us a little bit about Wyandotte County and how things are going and how we're doing as far as the next few weeks and months, you think, that are coming down the pipe.
Sure. Yeah. Well, first of all, thanks so much for having me on and having Dr. Greiner on this morning. It's been a busy time in Wyandotte County, as you can imagine. We've continued to see a number of cases on any given day. You know, we've continued to keep open our testing in the parking lot there. We're currently open from 9 a.m. to 3 p.m. Every day during the week, not weekends. We need a little bit of a break. Last week on Monday, we peaked for the sort of record number of positive cases in a day, and we had over, I believe, 130 cases that day, and so that was pretty intense. We've kind of gone back down a little bit. We're trying to get the word out about mask wearing. We continue to believe that is an incredibly important part of what we do as a community, and are urging everybody to take heed of that order in Wyandotte County. I think there are some really big looming questions in the community. We're getting a lot of questions, especially about school reopening at this time, which I'm sure we'll hit on today.
I'm sure we will.
Yeah, the big question of the moment, and we can talk about how that's going to look potentially in Wyandotte County. I will say that we've seen some shifting kind of throughout this pandemic. We've been very interested in issues of equity and keeping our community safe. We have actually a tremendous amount of community spread when you look at the number of cases in Wyandotte County and how large our community is. So we've got approximately 165,000 people in Wyandotte County, and we're sitting at about 3,800 cases right now. And first we were seeing many people, unfortunately, in our African-American community disproportionately affected. And now that's shifted, we think, to our Latino neighbors, and we're very worried about that. So we're doing a lot of messaging in Spanish and having meetings with our Health Equity Task Force specifically around that population.
Well, we thank you for that work. We know that's incredibly important. Alan, from your standpoint and what you're doing, and I know you work a lot with the county and with KDHE, how do you feel about where things are today? Alan, are you out there? Earth to Alan. All right. Well, we try to make sure his connection is secure. Let me ask you this, Aaron. The shift from the African American to the Latino community in Wyandotte County, what do you think accounts for that?
It's hard to say. We've actually had a number of meetings now with Latinx leaders in the community and folks who live in Wyandotte County and part of that community. And they say, culturally, family is a really big deal. There are important family gatherings. I mean, we've had a number of holidays now that, folks have really wanted to get together, and for good reason. I mean, that's how we,
Right.
feel better during this time, I think. And so I think that there's been a lot of family spread. I think a lot of our Latinx community also are working in those essential workplaces where they're out and about and going to work and such. And so we're just trying to drive home that message again of mask wearing, even when we're together with our families, if you're not in the same household all the time with those people. And we all know, I think we talked about previously that we know a tremendous amount of spread in other countries. We've seen studies out of China where we're from family gatherings. So just trying to drive that message home. There's also a lot of fear out there, about what this means when you test positive. We've gotten over some big hurdles, some trust hurdles, whereas we're seeing a lot of people come to us for testing. And so we're excited about that. But I think also when somebody actually tests positive, those next steps are incredibly important. How to isolate yourself when you're living in a big household with many family members. Those next steps are really important.
And I think to your point, any essential workers, any workers can wear a mask.
Right.
If you want to add eye protection, you go to your local hardware store, Amazon, whatever, add eye protection. That's going to help even more and keep you safe in doing those tips. And, I saw a patient who was 45 years old who, again, to your point about multi-generational, had a sister and a mother who was positive as well. So we're seeing it, I think, a lot in the families, just as you had talked about.
Well, we are, and in fact, one of the folks who works here and is behind the scenes today, Anthony, who does a great job. Hi, Anthony. Anthony was sick. His mom was sick. His sister was sick. All three that had COVID, and then some folks in the household didn't get it. And we've had Anthony on the show, and he's recovered well, but it took a while. I think I'm going to say, Anthony, about 6 or 8 weeks, right, to really feel back to baseline. He's nodded and said, "Yep." He was very gracious to be on, and does a great job here with us. So I think Alan Griner's on. So Alan, what's it look like? What do you see coming? And good morning.
Sorry about that. Yeah, thank you, and thanks, Dr. Corvo, for all your comments. I think we've gone through a rough month. I think we've all been real stressed out about the way the data have gone, but we are encouraged certainly by the fact that we've had less deaths than we would have, I think, expected at this point with the number of increased cases we've had in the last 4 to 5 weeks, and with the hospital numbers going up. As Dr. Corvo said, I think we are all super hopeful that the mask compliance that I think is getting better and better every day is going to stabilize things. We see a slight been the last 4 or 5 days even of things flattening out. And we think if we can get even more people on board with mask wearing and the other guidance that we've been giving, we can really get back to where at least we have some hope that some of our strategies are working. I think that's what we'll be focusing on, as well as the school issues that you mentioned earlier.
Yeah, it is encouraging. And obviously we're 2 weeks behind you because that's what happens with hospitalizations. But we're encouraged that we went up and we have held steady, and we've got our fingers crossed. The other thing we're encouraged by is much fewer deaths than we had early on. I'm going to find some wood to knock on right there. We have not had a death since June 27th, and I know that's going to change. I mean, I say around COVID. I mean, patients die in hospitals, unfortunately, but we've not had a death since June 27th, and that's a stunning statistic to me. And some folks are asking, why is that? And I think it's a combination of different things. First of all, it's a little younger population than we had initially. Second of all, remdesivir, steroids, and anticoagulation, they do make a difference. And we stopped using hydroxychloroquine. So let's be honest, that may have been hurting patients,
and
not
plasma
helping them.
too. Yep.
And we've been doing convalescent plasma as well. So I think those issues all probably combine to having a better outcome. And I think we've got some folks in the ICU right now that have been ventilated for a while. That may be a bit of a struggle, so we'll see. But nevertheless, it's been a lot better ride than it was initially around that. Having said that, doesn't mean you should take your masks off. It should mean you keep your mask on so you don't get in, because we still have people on ventilators, we still have people sick, and this is not the flu. If I hear one more person say to me, "Oh, this is just like the flu," I may scream. Because I've been able to keep it calm pretty much. I can usually keep it together, but that phrase, either it's a hoax or this is just a flu, make me want to scream a little bit.
Yeah, as a doctor taking care of patients in the hospital, it's actually, I mean, I know you all have as well, but it is striking how ill people can get, and younger folks that you just wouldn't expect that, with the traditional flu.
Yep.
So.
Yeah,
And if you are recovered, that doesn't mean you can take your mask off either. If you've survived COVID, that does not mean that you can take your mask off either. So.
Yeah, and because there can be different strains of COVID around, we don't know the whole detail about that, and we don't even know how well our immunity lasts, how long, or how protective it is. Yeah. We think it is, we're hopeful, but we don't really know that yet for sure, right?
Yeah, I think the biggest questions about immunity once you've recovered is how much and how long. Again, we think and hope that you would have some immunity at least 3, 6, 9 months, and if you get exposed to it again, you'll have either no symptoms or certainly much lighter symptoms, but we don't know. Hopefully now, as we've kind of been going through this since March, essentially, we will start to get that data back and have more concrete answers for you.
And I know that someone recently said mask wearing had finally become patriotic, and I would say, well, I think it's always been patriotic. I think it's actually always been the right thing to do, because mask wearing is for everyone next to you. Right, that's who it's for, and it's for yourself and for your loved ones, but you're really taking care of everyone. It's such a simple act to take care of everyone. Let's see if we have questions for media. I'm not hearing any there, so that means we're going to open up to our listening audience, and I bet there's going to be questions at schools, et cetera. Let's see what's out there, Jill.
First question, multiple people are asking, what is Wyandotte County recommending in schools about social distancing?
Right.
People are skeptical because schools, they think of them as crowded classrooms, crowded lunchrooms. What are the recommendations?
So Erin, what do you think? Help us with that, because I know that's a question we've been hearing each of the last few days.
Yeah, it's a great question. We think that social distancing, if we can get kids back in school, we think social distancing is going to be a really big part of how we need to run things. We're thinking at this point in time, if we continue sort of at the same rate of cases and such, that we will probably be able to open schools at about 50%, is kind of what we're looking at. And, in that 50%, we would really expect that, at any given time, given a capacity of, a room or a building itself or whatnot, that we would be spread out, with that 6-foot distance between each kid. The other thing I want to emphasize again is we are going to absolutely require mask wearing in the schools. Even for our little kids. And so I want to encourage parents, even right now, I know kids are squirmy and they, want to touch their faces and everything else. But start now with your children and help them sort of practice mask wearing throughout the day and when you leave your home. So we'll absolutely require that for the teachers and for the students as well.
Alan, what about, we have the mask wearing and things, but Wyandotte County is not a rich county by any means. Will the children who are at home still be able to learn through internet or Zoom, or how's that going to work?
Yeah, they will, and I think we will see some families that opt, even if we're able to do, as Dr. Corvo mentioned, and space kids out. I think there will be families that opt to have their kids do virtual learning at home, and that's fine. There are quite a few supports in Wyandotte County. Some of the school districts there have really been innovators in technology. You remember that back when Google Fiber first came to Kansas City, they made their announcement over at Wyandotte High School in Kansas City, Kansas. And so they've done a lot of innovative things over the years that I think can be leveraged now to really help kids. There are going to be families that struggle. So I think the schools are trying hard to come up with all the supports and mechanisms they can to help families that are going to face technological issues. But I think there'll be lots of things we all learn out of this, and hopefully we can keep it all going and that it can be affordable. I think we'll find ways.
Okay, good news for Wyandotte County families, because clearly you want to keep them safe, and clearly you want people to learn, but you also have to be able to do that if you don't have, the financial resources to have broadband in your home. So
Sure.
That's got to be a big struggle. Jill, next question.
They want you to clarify on half or 50% go to school. Is it half? Are they going to half a week, every other day?
So what you're asking is, how do we structure it? How are you
Yeah.
going to do that? What's the recommendation?
We're actually going to have each of the school districts submit plans to us with this idea of 50%. And again, it's more of a 50% capacity of bodies in a space at any given time is sort of the big issue. And so, again, to practice that social distancing and such. So some schools, our superintendents have talked to us about, bringing back the little kids, our elementary age students, for everyday school and socially distancing them, but having, for instance, the high schoolers be educated at home because they are kind of more able to do their own thing, online. That's certainly an option, but others have come up with other ideas, having different cohorts, the A group, the B group, bringing students back day in and day, one day on, one day off, that sort of thing. So again, we're going to be having more direction and possibly even an order come out Friday or Monday, and so please stay tuned. There's going to be a lot coming out on the WYCOKCK.com website for the community.
So, Alan, some of the stuff has been out there and talking about children who are of elementary age or 9 and under, 10 and under may not really be vectors or spread the disease as much. Has that figured into your thinking at all?
Yeah, I think it has. I think we're hopeful to get even more data on that issue in the coming days, because it would be nice to know that different age groups of kids are less likely to spread amongst themselves. But yeah, and I do think, as Dr. Corvo mentioned, we think that if that's true, and we can have the younger kids doing cohort style classes where they're always together with the same group of kids and always with the same teacher, that makes a big difference, because then we think we can, if we do get a case that pops up, you can figure out who was around that case, and it's a lot less people that were around that case. So we will probably have significantly different recommendations about the younger grade groups of kids than we will with the older groups, but we'll work with the schools. We want them to be able to tailor it to how their facilities look and what their staffing capacities are and all that stuff. So I think there's multiple ways people can achieve this idea of basically having 50% less density of people than what you previously had. That's kind of the overarching idea, is like, if you take a school space, how can you figure it out so that the density of the bodies is 50% less? There may be as many bodies in that building, but if you can spread them out into gyms and auditoriums and common spaces that you previously didn't use for education, then you can achieve that social distancing.
Hey, Dana, I remember we've been talking to folks from Children's and we've looked at this pediatric data, but remind our audience, why would children who are of a younger age, 10 and under, be less likely to spread the virus? Because that's so antithetical to how I'm thinking. Originally we thought, oh, they're the vectors, they're the super spreaders, but it turns out to be not so much.
Right. Yeah, dogma for any other GI illness or respiratory illness. Certainly daycares and schools are bad because children spread it. We don't really know why. So we understand that from indirect evidence based on household contacts of children who have it, but the adults don't have it. When they look at those contacts, the attack rate is certainly much less. That means the spread from the children to the adults is much less, say, if an adult has it and brings it into the house. So that's indirect evidence saying, well, maybe the children don't spread it as less. We also understand, however, that children do seem to reproduce the virus in really the same amounts or concentrations in their upper respiratory tract as adults do, or older kids. So we don't understand that really as well. That's just a few studies, obviously. But the other thing is, one of the physicians was talking about, well, maybe the children don't have the receptors that the older children have. So the virus has to attach to something in your respiratory tract, and that's called the ACE2 receptor. Influenza has a receptor as well. That's different. So they think, well, maybe the children don't have the same amount of receptors. They aren't as able to get infected or spread it as much because of that. So we really don't know. But based on that indirect evidence of lack of transmission to other household contacts, certainly in the early studies. Now, again, we're seeing differences now as we're seeing a lot of middle-aged and high school-age kids getting the disease, especially in our community, and possibly spreading it to the adults as well. So again, just early data. We don't exactly have the answers. We're going to continue to look, certainly take guidance from CDC and look at all the other published reports, not only from the experience in other countries, because a lot of it is from other countries' experiences, but our experience here in the United States.
So really, is once again, a parent should be terrified of puberty. Is that really what we're thinking about here?
The teenagers, the mean-agers, I don't know.
Watch out for that. So, all right. You were asked yesterday, are you sending your kids to school? And you said, yes.
Yeah, I think we've always preceded or ended our comments with if it's safe, but I think that there are definitely benefits. Again, we do need to keep the teachers, the administrators, the counselors, everybody safe, and we gave tips on how to do that. As you talked about, the spacing is important. For the most part, if the teachers or the administrators or other people who are interacting with the children, if you can maintain that distance for as long as possible, if you do have to interact with them, help them with reading, help them with problems, that interaction should probably be short, not the prolonged 10 minutes. And if both parties are wearing a mask, that's going to help as well. So at this point in time, I would like to send my kids to school if the schools do open and if it's otherwise safe, for sure.
Well, and I think the key is, we were asked again, well, do you support Governor Kelly's plan? Do you not support Governor Kelly's plan? Where do you guys land on that? And, we are a healthcare provider. And to be clear, we're going to try and stay as best we can in our lanes around healthcare, because that's what we do. And so we're going to make recommendations to you to keep you and your family healthy and safe. That's our job. That's what we preach, and that's what we're going to keep on saying.
Yeah.
So when we talk about schools reopening, what we have tried to say the entire time is the same message you gave us, Aaron. How do you do it safely? Then it's up to parents and the school districts to decide if they're going to open up schools or not. That is not up for us to say. But we will say, this is how we stay safe. And the rules of infection control go wherever you are. They don't change just because you're in a school or you're in a hospital, or you're at Chiefs Stadium, or because you're at Allen Fieldhouse, or because you're down at the bar or the grocery store. The rules of infection control are the same wherever you go.
And I think, to your point too, when the school conversation started 2 or 3 weeks ago, those infection dynamics in our community were much different than they are today. And we continue to have our evolving thought process as our data evolves. And Alan Greiner can speak to that, and you can speak to that with especially specifically for Wyandotte County and the rates of infection and the demographics and all that.
Because you guys are taking a little different tack than other counties because the county's different.
Yeah, that's right. I mean, we've got to be pretty agile, and things are changing quickly with this virus, as we've seen over the past 4 or 5 months. Yeah, definitely. So I think it was really interesting, the outcome of the excuse me, State Board of Education, that vote yesterday, and they said, Governor Kelly, we're not into your executive order. And so we're thinking about that outcome and what we might do in Wyandotte. Again, we'll have updates either tomorrow or Monday on sort of how we decide on that as well. I have to shout out to our educators in Wyandotte and our superintendents. We've been actually working with them for a couple months already in just sort of anticipation of this. And what that has done, I think, for us, even though we're at a different point in the pandemic now, is that really solidified some of those relationships. And, we've got each other on speed dial now. And so I feel like we've got really good relationships, which helps
Well, it helps
in a pinch.
tremendously. And I think, the mayor has done a great job in working
He's
with you
awesome.
guys and
Yeah.
Mayor Albee and
Yep.
everyone. And I just have to say, one of the things that happens with Wyandotte is I think it's actually a pretty underappreciated county. It's got some pretty interesting things going on. It's one of the most diverse counties in the United States.
It sure is.
And when you look at that and you say, okay, that means we're going to have a different set of challenges than, say, Johnson County has. So there are economic challenges, but it's a diverse county, and you have to account for lots of cultures, lots of different types of behavior. So talk to us a little bit about that, because I think that's an undersold story about Wyandotte County.
Yeah, I mean, I've really fallen in love with Wyandotte County again through this pandemic. I mean, there is some silver lining. Really, I think the crux of what I want to talk about with this question is the messaging. I mean, we are messaging to many different sort of sub-communities
Yes.
that make up Wyandotte County. And so we've had to do that in various languages. We've had to do that in various ways and different venues, radio, television, in-person, flyers, et cetera, and really actually personal relationships. Word of mouth is extremely powerful in Wyandotte County. So knowing that, we've kept our community liaisons and advisors extremely close. And I think one of the best things that Dr. Greiner and I and a few others were able to do early on in this pandemic is form that small but really powerful health equity task force. And that has helped us, I think, to just continually learn about how should we be messaging. And frankly, all of these people on the task force, they have these tendrils, out into the community, and they've been great partners. So we're very grateful. I don't know if Alan or Dr. Greiner, if you'd like to say more.
Other thoughts about that, about the diversity and some of the things you've had to do, and including tell our listening audience some of the languages you've been talking in.
Yeah, and I think it's been a learning experience for us, but I think, our health system has been embedded in the county for forever, right? And so I think we've all learned that tailoring that messaging is so important. Empowering community members to be part of the work. We've had a bunch of pastors involved who can spread the word through their church communities. We've had various nonprofits that serve different segments of the community involved, and they've all just been so powerful in helping us do what's required, really being flexible and being able to meet people where they are.
Yeah, I know there's a lot of Southeast Asian communities, Ukrainian, Russian. I mean, Wyandotte County is a fascinating conglomeration of different folks. So next question, Jill.
Robin wants to know, if you were teachers and you had to go into the school, what would your routine be? What are you going to wear? How often are you going to wash your hands? How would you protect yourself throughout the whole day?
Well, I know my first answer is wear a mask, wear a mask, wear a mask, wear a mask, and then wash your hands constantly and use as much alcohol sanitizer as you can.
I think that's the right answer. I mean, I think we can certainly have you wear a face shield as well, which would be extra helpful and being careful in that way. If you want to have certain clothes, and I've talked with teachers and superintendents about this, if you want to wear certain clothes so that you can sort of at the end of the day put those aside, and that's a good way to do it as well. You're the infection guy. What do you think?
No, I certainly agree. Okay, so first is the mask. And then we advocate for eye protection, whether that's goggles from the hardware store or whether that's one of the 3D printed face shields that just go on like a welder's mask. Obviously,
every day. They're in my pocket.
See the
will be
side
issues.
panels.
All right,
Yes.
side panels on the
The top.
side, a little covering at the top, a little at the bottom, and I look cool, right? I look cool. Well, okay, maybe not cool, but it could be a step up.
And obviously, there can be problems with fogging. You know, walking through the hospital today when I was seeing patients early in the morning, I had fogging. I get used to it. It may be a little bit more different in the classroom setting, but also I've seen people who put tape across the top of their mask to help reduce the fogging. So just starting there with the PPE. Obviously, the hand sanitizer, if most rooms can have alcohol gel, if that's possible, or if there's a sink to do frequent hand washing, avoiding touching your face. If you are teaching, you know, try and stay 8 to 10 feet away from the students when you're giving a lecture or talking about certain things. If you have to interact with them, help them read, help them comprehend, do the math problems. You can do that small interaction. If they can have a mask on, you can have a mask on. You probably aren't going to be that long in prolonged close contact with them. Do that. As you start to do this, and as you start to, if we do open schools, those things that are conscious will now become subconscious and become second nature to you. And that will then spill over into your regular everyday life. And right now, that's kind of just what we have to do. But those are the tips that I would give if schools open and if we are back in the classroom setting.
And I'll just say, you know, we don't have a mask on today. We were talking about it beforehand, but we're 7 feet apart. We measure it. We have the right kind of airflow in this room to get rid of our particles. And so we know, but as soon as that door opens up, we put our masks on because the air handling changes and we start moving around. And so it's something we do every day. And our guys in the control room behind us, they're sitting closer together, so they have to have masks on. And they have a little different airflow in that room. So we do all the things we have to really stay safe. So I think that's the key for teachers. To follow the rules of infection control. Wear a mask. I think wear goggles. I do.
Yeah, I do.
Really
I
preach
agree.
the wear a
I
goggle
agree.
thing because
Yep.
you've got your eyes are mucous membranes and you touch your eyes with your hands and you rub your hands. So you just wear goggles, not glasses. Glasses are not enough.
That's right.
Wear the goggles
For any essential workers.
yeah. If you have some ski goggles, wear those and you'll think, well, I look funny. Well, you could be me and look funny every moment of every day. But the reality is that it does keep you safe. And what we're talking about, and we keep saying this. We think this is not going to be forever, right? You know, the United States has ordered 400 million doses of vaccine that will be available between October and December. That's a remarkable statement. They're already paying companies to develop it because they're so much confident that the vaccine's going to work. We've heard me say before, I'm Mr. Rose-colored glasses. I think it's going to work. I think it's going to be here. I think it's going to help keep us safe. We don't know that yet, but there's a darn good chance it's going to work. And I'm pretty confident that by January, we will have people at Arrowhead Stadium.
And I think for the adults in the schools, they have meetings too. And we touched on this yesterday. You know, no longer can you meet in a 8 by 10 room with 4 or 5 or 6 people.
That's right.
Find areas where you can meet separated or do the Zoom. Make sure that the masks are on as well, because we especially don't want our teachers. We talked about substitute teacher shortages. We don't want our other administrators and our other essential people in the schools to be ill either. So if you can do that, and it starts with the adults and then can filter down to the classrooms as well.
You know, here's what we know. We've been saying BKC, and we can bend the curve, and we did. And we can stay safe with school reopening, following the guidance of people like Dr. Corvo and Dr. Greiner, and we can BKC again, and we can stay safe. But it takes a commitment to those rules of infection control.
All right, another question. Shirley and a lot of people want some clarification around testing. Specifically, people that get repeated tests, are all of those tests being counted as, are they adding to the number? That's one of the things
Right.
that they
So
have. And they want to know
yeah.
your confidence in testing too, because early on we didn't have a lot of
We
confidence.
didn't. We have a lot more, but we'll break this conversation down a little bit. Let's start with, are we comfortable with nasal swab testing, and do we think it's accurate? I think it's really accurate, Aaron.
I do too, and I think that's our gold standard at this point.
Yeah,
Yes.
it really is. And Dana,
Yeah.
the antibody testing has been a different question, which we weren't sure was very helpful at the beginning, and it has to do with a lot of math and background prevalence. We don't want to try and we'll take forever in that part of the conversation. But the reality is it's gotten better.
It's gotten better. So at first there were a lot of companies that put out antibody tests. Again, we know that there was a study with Mayo and ABC News that looked at some of those tests, and even when they tested saline for it, it was positive. So it shouldn't have been there.
That's
So
not
basically,
very, that's
that was
probably
a
not very
faulty
accurate.
test.
Bad test. Bad test.
We've had Dr. Plapp and Dr. Leisman here at the health system who validated and vetted several different companies, and we did land on one. And I think now there are maybe 3 or 4 that are really good to detect the antibodies. But what does that mean? Again, we said that if you are recovered from COVID, that doesn't mean you can't wear a mask. If we detect antibodies in you, that's good. You can certainly donate plasma. Please donate convalescent plasma and other blood products to Community Blood Center. But we don't know exactly what that immunity means. That means that you've seen the infection or the virus and that you have now some antibodies to it. Again, hopefully that will confer and give you some immunity if you are ever infected with it again, but we don't exactly know. But to answer the question, we know that our test here is pretty good and validated, and if it says that we didn't detect antibodies, then you probably did not have exposure to COVID, and if it did, then you probably actually did. So the sensitivity and specificity is pretty good.
So, Alan, how does the county handle people who have repeat negative testing? And I do have to say, I don't think there are that many people who have repeat negative testing, because it's hard to get and eventually have to start paying for it. But how does the county handle people who try to get a lot of tests and they're always negative?
So we've really tried to discourage that, because we don't think it's super helpful in guiding decisions. I think we've all been pushing the idea that if you have any kind of symptoms of any illness, you should really stay home. I think that's a new normal, just like mask wearing is a new normal. We've got to get people to realize if you're showing any signs of illness, stay home. It doesn't matter if your test is negative 3 times or not. We worry that there are still some false negative tests that happen to people, and we just want to encourage. One-time testing is probably helpful for making decisions in terms of whether somebody needs to isolate or not. But multiple testing is something we don't feel like we have the resources to support that either at this point.
Yeah. So do you mind?
And I should say too that so the test is very sensitive. It can pick up very small copies of the virus if you have it. And this is, again, the nasopharyngeal swab, the PCR. And we have really never been advocates of repeat testing if you are positive. That's if you have symptoms or not. And this is because we know from lots of published reports now that you can have positive tests for 60, 80, 90 days. So the positive test really doesn't help. In fact, the CDC now has updated their guidance, suggesting that you don't need to have negative tests after you've had the illness, symptoms or positive tests. In fact, they're just going by symptoms at this point, because we know that it's very difficult to get negative PCRs after a positive test or the illness from COVID-19. So those are new updated guidelines from the CDC. And again, they aren't really recommending repeat testing either.
Dr. Hawkinson, I want to really just say that's absolutely how we feel in Wyandotte County.
Yeah.
We've had a lot of businesses request that people get a negative test, before coming back to work. So these are people who have tested positive previously, and they come to us and they say, I'm desperate to get retested because my workplace says I need a negative test to go back. If you all ever experience that, we want to know about it at the health department. We're happy to reach out to your the business that you work for and talk with them about that, because our guidance is that no, you really shouldn't be repeat tested. Just as we learned now, you may test positive for a really long period of time, but you may not be still spreading the virus. And so we feel like it's probably safer to bring you back to work, even later on if you're asymptomatic and you've gotten better and, you're feeling great, before you've got a negative test.
Well, and
Yeah.
the truth is that after you've recovered from COVID-19, and again, 10 days and the negative temperature and all those things, you are probably likely less likely to give that to anybody else than someone else who's in there, because you've already had the virus. You're going to have some antibodies to it, and the other people who you're working around are more likely to spread it than you are.
Yeah.
That's right.
So I think you just have to think about it. If you know the science, you're not going to repeat
And
test.
so far,
it's fear that's driving that.
Exactly, to your point. So far, the best concrete evidence we have is in the animal model. In a lot of infections and things, we use animal models. For SARS-CoV-2, it's the rhesus macaque model. And when they actually re-challenged rhesus macaques in 2 different studies, 4 weeks to 6 to 8 weeks later, they found that actually the amount of virus that the monkeys produced was much less after an initial infection anyway. So basically, we're going on the time basis, time from diagnosis or time from symptom. And it's really from the other small amounts of data that we have, they really aren't able to culture the virus, live or infectious virus, after about 8 to 10 days after a human with illness. So,
Jill,
And
another
the
question.
multiple tests, are they skewing the grand total?
oh,
Yeah,
that was a good
They
question.
could skew the grand total, but there aren't that many people out there who are getting multiple tests, kind of compared to the total number that are getting tested. And so I don't think it's going to skew anything.
Right. I think we've tried very hard in Wyandotte County to clean up our data. We did have that concern as well. And so, again, we're really recommending that people not do that. When people come for testing, we're asking them, have you been tested before? If they have, we're going off that first initial test.
Yes.
And in our hospital data, we can figure out, because we know the
Yep.
unique
We do not
identifiers, and
report
so we don't report repeated
Repeat
testing.
tests.
Lola wants to know, should high schools and middle schools test all students and staff similar to what KU is doing?
So let's clarify, though. KU is a little different story, because KU represents a mass migration of 25,000 people into a community of 80 or 85,000 people. That is a completely different epidemiologic question than trying to reopen a school. So I think those are two different things, Aaron.
Yeah, I don't think that that's something that we're going to be doing in Wyandotte County. I don't know if there are other communities that are going to be mass
I don't think
testing.
not
but-
for public schools. Again, it's not a
Yeah.
mass migration of
Right,
people.
that's right, and I think the most important thing that we're looking for is people who are not feeling well. Teachers and students who don't feel good, of course, should be tested immediately, or those who are close contacts of those who are ill should be tested a few days after that contact.
And I would just say that the other thing that happens is we're bringing students from all over the country and all over the world into KU, and that's just a fully different dynamic. And the other reason to do mass testing at KU is to help prevent a rapid surge of disease that overwhelms a healthcare community. So there are a lot of different factors that are going on at KU that aren't true when we open up our elementary schools or the high schools. Now, having said that, there's still a challenge reopening high school and whether or not
There is.
young people will be good at a pandemic
Sure.
or not. Traditionally, they're not, and so that's a challenge, but that's not a testing challenge. That's a behavioral challenge, and those are different challenges.
The other thing is that, of course, testing by PCR, as we've been talking about the traditional nasal swab test that we think is very sensitive, that is really a moment in time.
Yeah.
And so we know at that moment that somebody may be negative, but even the next day, if they've been exposed, it's just a moment in time. And so even just a few days later, somebody could be positive if there was a previous exposure. So it's complicated.
It is complicated. Great question, though.
Yeah.
Leanne wants to know, should teachers go paperless to have less?
Oh, are we worried about paper? Are we worried about surfaces,
Not as
Dana?
much,
What do you
huh?
think?
Yeah, I don't think, certainly we're worried about maybe the non-porous or the surfaces like tabletops, desktops. But even then, it's much less the fomites, the inanimate objects, such as tabletops or door handles or paper, than it is being in close proximity with people. Certainly we know it can be spread that way, especially if you are touching those surfaces and then touching your eyes, your nose, or your mouth. But that's going to be much less. I don't think there needs to be a fear and anxiety about paper tests or anything like that. And again, work on practicing good hand hygiene. It may need to be a conscious effort and something you need to think about, but eventually it will become a subconscious effort and just second nature to you as well.
One classroom apparently is considering creating bubbles within the classroom of 6 students in a pod. Is that
Interesting
effective?
concept. Yeah, can we bubble students? And the problem, of course, is they move in and out of different
Yeah.
bubbles during the day.
Well, yeah, I think you hit on it. It is an interesting idea. I think, as Dr. Greiner said a little bit earlier in our conversation, he hit on this idea of cohorting students. And so we're actually very interested in cohorting and think that's a good idea. That means, the same number of students is interacting with the same teacher, and that's sort of the group for the semester or whatnot. So I don't know if the 6-person is going to be able to kind of stick together, but I would just say if those 6 people are in the cohort, then they probably shouldn't be interacting with the other
Lots of other
cohorts.
kids out there.
The problem is they're moving out of that cohort when they go home and into the community.
Right.
And so that cohort is for a very small amount of
Sure.
time.
It's a small amount of time and probably not a real cohort at that point.
Right.
Yeah.
And even when we tell people, when we're doing shelter in place, you're at home, figure out who's in your bubble. You have some control over who's in your bubble. You have an agreed upon set of behaviors. So for us, it was my wife and I, our 2 kids, and their significant others, and we had they're the rules. We still have those rules, but how we do that so we can all be around each other. But if you go outside of that cohort consistently, it's not really any longer a bubble or a cohort. But I'm using the term cohort and bubble interchangeably there. But if you go outside the bubble, it's not really a bubble, and that's what you have to think about.
One last question.
One last question. Let's do it.
Fans and air purifiers, would they be helpful in a teacher's room?
Okay, air purifiers and fans. That's a great one. It's hard, because the fan dynamic, it's a funny one. It's how you handle airflow in an entire room, not just right in front of you. And the air purifiers generally are so small, they're not going to handle a classroom very well.
Yeah, and this is a difficult question. I do have a friend that works with a company with a product that's being put into a lot of locker rooms, a lot of professional and college locker rooms. I think it can help as far as the air purifier. You addressed the fan. I think those are all adjuncts. It's not going to be something that is going to save the day. It's not a panacea. The more important panacea, the more important things that will work is the distancing, the mask if possible. We saw that from some of the investigations, particularly in one of the cruise ships, that really the HVAC systems were not implicated in spread of that disease. So I think it can help. It can be an adjunct as far as air purifiers. But that's not going to be the main thing that is going to keep people safe.
Yeah, don't bet your life on it. Let's put it that way. Alan, final thoughts from today.
Well, I think we've all just got to, as I mentioned earlier, think about the new normals we're going to have for this fall semester in schools, and I think in life in general, we're going to be mask wearers, and we're getting better at it, and we're hopeful that the data is showing that, because then we've got proof that this intervention has really helped us in our local setting and in this country, and so I think if we can work together on some of these new behavioral things in the coming months, we can get through to when we do have the vaccine. I think that's what we all need, some of that hope and some things to look forward to as we go forward.
Yeah, and I think that's really important. And so thank you for being on the program today. And just to say, Dr. Greiner, I think you just got a really big award here recently. Aren't you named you're now a professor, and it's a endowed professorship. I mean, somebody just recognized all your work in Wyandotte County. Aaron, do you know more of those details?
Oh, I think Dr. Greiner or is he the Nason endowed professor?
I think that's right. I think that's a big deal. And I just want to say
Dr. Greiner.
congratulations and thanks to all the great work
Yep.
you've done in Wyandotte, Alan. We're proud that both Alan and Aaron are faculty here at the University of Kansas Medical Center and part of our team of physicians here at the University of Kansas Health System. So that's a big deal. Final thoughts from today.
I want to echo what Dr. Greiner said. Mask wearing is the way to go. And I think that, just this week, we're seeing just a tiny bit of that turn of that curve.
We're starting to be KC.
And if we can continue to see that turn, we won't need to shut down, other parts of our community. And we're trying really hard to keep things open. So please wear your masks.
Yeah. I think we all do health because we care. We care about people. As now the pandemic has put us into greater amounts of public eye, we care about public health. You and Alan Greiner definitely care about public health. As you touched on, we have to reach a lot of audiences. And the most powerful thing is word of mouth. And so what we are doing here is continuing to give the best quality evidence to keep you safe, to keep your family safe. Overall, we think it's working if we can see a bending of that curve and flattening, continuing to give our conscientious message. Hopefully, people and communities will continue to hear that and do the right thing, and we can get through this pandemic.
There's a picture coming up of Brian wearing his mask in the car. He cares about you and I and all of us, and so thanks, Brian. Kelly says the 3-year-old Charlie is protecting his fox, and so they masked the fox. I like that. Well done, Kelly. Just to be on the safe side, and Charlie, great modeling. And right here on our own master control unit, we referenced it just a little while ago. Logan and Anthony are back there, and they're wearing their masks. Thank you, guys. Thanks for all your hard work. These guys are the unsung heroes behind the scenes of this whole program. They do a great job, and Anthony is a survivor of COVID-19, so I promise you he is a firm believer in wearing that mask. Tomorrow we're back answering just questions. It'll be great. Dana and I are on the hot seat. That'll be fun.
Yeah.
You know, folks, there's fear in their science. Some have been criticized for being wrong. I think Dr. Fauci has been criticized a little bit around that. And it's kind of funny because I don't think Dr. Fauci was wrong. I think he just didn't know because we didn't know. But, you know, we do know some things, right? We do know. And that's the science part of that. The science is clear. Masks do not kill you. They don't cause you to inhale carbon dioxide. Masks are uncomfortable. There's no two ways about it.
Yeah.
But masks save lives. They saved the life of patients in the operating room when the surgeons started wearing them, and the rates of infections dropped dramatically back in the 30s and 40s. We started washing hands. Hard to think we didn't do that, but we started washing hands. In the AIDS epidemic, we started wearing gloves. And you know what? People got better. They did better. Masks save lives. That's science. Fear govern you, and fear can lead to some really bad choices. Just remember that there is proof in masks that has been earned not over just this pandemic, but over generations. Masks work. So stay with us. Stay with our program. Put that mask on, keep yourself safe, and keep everyone else around you safe, just like Kelly and Charlie and Brian and Anthony and Logan and the thousands of other people out there who are wearing their masks. We'll see you tomorrow.